All right, thank you so much, guys, for coming today. So today we're doing the review for lectures 16 through 19, and for the final exam. So this is pretty good. We're moving right along here. Oops. Advance it here. All right, as usual, I'll always start with the format, right, of the exam. And this time we're going to have 4 sections. Okay, we're going to have section 1, which is our usual multiple choice, right? And it's going to be, this time we're going to have 20 questions times 1, which is 20. So this is the fewest you've had so far. And section 2 is our matching and sentence completion. Okay. Sentence C or S, whichever. Okay, so it's gonna be 5 times 1 plus 5 times 1 plus 10 times 1. So this will equal, so this will be like a pick from the word, from a group of words, and I'll give you a description, and then you match it with the term that you pick from a few words. And then here will be like a sentence completion. I would say dash 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 blank equals whatever. And then you pick from a list of words again. Now this one will be the actual matching, where I'll give you a scenario, whether it be a sequence of events, whether it be the anatomy of the female or the male reproductive system, and you track, say, gametes and things like that, okay, from the site of production to wherever I lead you, okay? So, and you will have, you have to pick the correct structures or organs in their correct order, okay? So that's 20 points, okay? Section 3, so this is going to be a fun section, actually. I'm sure you're going to enjoy it. I'm not just saying it, it's really true. You will like this section. I was working hard on it. Okay, and then this is short answer, our usual short answer section. So you will have the usual 5 of 6 times 2, which is 10 points. And then section 4 is the usual long answer section, okay, and you will have, this time you like this, 3 of 5 times 5 is 3 times 5, 15, right? So 20, 20, 40, 50, usual 65 points, all right? And of course, if you had done your course evaluation and you let me know about it, then I'll also give you 3 bonus points added to, let's say you get 65 out of 65, okay? Then you get 68 out of 65, right? If you had done your course evaluation and let me know about it, okay? Because you can choose to let me know or not, because students were worried about privacy. So I won't be able to go and ask the office to tell me who has filled it up. It's you who elects to let me know or not. But I want to see what you filled in. I'll just know that you've completed it. And once you've completed it, then I give you the 3 points. So you gotta do it, I guess, by December 1st. All right, and let me know that you have done it. You can use the system to let me know, or you could actually just send me a separate email and say, oh, I've done the course evaluation. Then when I'm grading, then I will give you the bonus points. Okay? All right. Thank you so much, guys. I would appreciate all your feedback on that, right? Because we really use that a lot. So the first one we're going to do, of course, is the male reproductive system, the first lecture. So when we started talking about the male reproductive system, we talked about the functions of, the reproductive system in both males and females, just sort of the general functions, and those are them, produce offspring, produce gametes, so you have, your primary sex organs will do that, ovaries for the female, and testes for the male, all right? And also sex hormones are involved in stimulating gamete production, such as testosterone for males and estrogen, progesterone for females, right? And then also accessory organs assist with the reproductive functions for both sexes, all right? And they are different for each sexes, so the accessory organs help out, okay? And of course, this is the end of the reproductive system functions. Sometimes I may say, okay, can you list 3 or so, or 2 reproductive system functions? Then you talk for both sexes, what they do, which is produce sex hormones, produce gametes for both sexes. We need ova, we need sperm cells, and then produce offspring. Okay, and then if I'm specific, sometimes I'm specific, so you could have like a 2-point question with a balance of 3 or whatever for the general reproductive functions for both sexes. And here, now we're talking specific about the male now, okay? If I ask specific, give me functions of the male reproductive system, then you know that the male is to produce sperm, it's got to transfer the sperm to the female, and it's got to produce sex hormones, and those are important for, secondary sex characteristics, and also formation of the sperm cells, right? So, so you have to be careful what I'm asking about. If I'm asking generally for both sexes, then you talk about that. If I'm asking specifically about the male, or I could ask specifically about the female. The female has got a few more functions than the male, actually, in terms of contributing to reproduction. Okay, so just beware of that in the exam. Because sometimes you read a question and then quickly you answer. It may be correct, but it's not what I'm asking. You see, so be careful with that. All right, so very good. All right, male reproductive anatomy. So pretty much we start off with all the organs, and we'll talk about each of these organs. So we know about the testes, right? So this is the primary organ, okay? The testes are the primary organ. What else? The testes, are covered by, the tunica albuginea, which is a tough connective tissue, all right, that separates into septa, into sections called septa, right? The testes in the male. It separates it into sections called, it will interdigitate inside. So, for instance, it will produce these sections like that. Okay, so this is a testis. So each section will have seminiferous tubules in it, right? Okay, and then in the tunica vaginalis. So I want you to know the structure of it, and where also covers the testes. Okay, the tunica vaginalis is on the outside, and it comes from what? The peritoneum, right? Okay, so these are some of the things that I can sprinkle in that section where I will have describe a term. I'll say this covers the testes and arises from the peritoneum. When you say tunica vaginalis, that kind of thing for those mentioned sections. All right, and you know that. The testes, where the sperm cells are produced is the seminiferous tubules, right? The seminiferous tubules are located in these sections that are divided by septi, right? So know these structures, you know, because these are things I'll put in the sentence completion or things like that, all right? And I want you to know, for instance, the site of production for the sperm cells, because I could help you track that. Okay, so the sperm cell, where does it start? In the seminiferous tubules, right? And then it goes where? To the tubulus rectus, because they are straight tubes. And then it goes where? To the retitestis. Retitestis. Okay, which is like a net-like sort of structure, like that, right? And then the retitestis goes into the efferent tubules, right? Efferent tubules, where do they go to? The epididymis, you see, things like that. And you can see this in the pictures. There's a picture that's in the book that shows the testes. After the epididymis, it goes into the vas deferens, right? We are tracking sperm in this case. The vas deferens leads to the ejaculatory duct right there behind the bladder by the seminiferous vesicles. Then it will go into the prostatic urethra. I want you to know the three divisions of the urethra too. You know what I'm saying? So the prostatic urethra leads where? To the membranous urethra at the base of the pelvic floor, right? And then it goes into the spongy urethra, which is leads to the outside, one of the erectile columns of the penis, right? So know about that. So these are the ducts I just talked about in the male, right? So know about that. I only wrote a few there, but I went through and they're in your book, so look at that. So this is some of the things that I will use for those matching sections, okay? And then accessory organs, all right, you got for the male, what do you get? You get the seminiferous tubules, I mean the seminal vesicles. Seminal vesicles. What else you got? Prostate gland, very good. What else you got? Bulbourethral gland, the one that produces the mucus. So you gotta know these, you gotta know what they produce. Okay? I don't know if I have the, yeah, very good. And then these are supporting structures. Okay? The scrotum supports the testes in, you know, it's a pouch of skin, really. Okay? And it supports the testes. Okay? And we need to know the muscles therein, you know, and the penis. What does the penis do? It becomes erect, and it is, what is inserted into the vagina, right? And it's got those three electoral columns, the corpora cavernosa, two of them, and the corpus spongiosum, which is where the urethra is located, all right? And then the scrotum has got a smooth muscle called the datus muscle, right? I want you to know those structures in there, three erectile columns. And here we've got a datus muscle. Okay, sometimes I'll put this in the, you know, I may describe it, and then you pick it, you know, from a group of words. The datus muscle is the one that wrinkles up the scrotal sac, the skin, all right? And that one is smooth muscle. So if I'm talking smooth muscle, then you know that is the datus muscle, one that wrinkles up the scrotal sac, right? And if I talk skeletal muscle, I'm talking about which one? What's the other muscle that you know, moves the testes up and down, starts with a C? Cremaster muscle, okay? All right, guys? So you gotta know these things, because, you know, I will describe it for you and I'll ask you to pick it out of a group of words. So you definitely gotta know this, the difference between those two muscles and what their functions are. Okay? And this one is the cremaster muscle is located in the spermatic cord. It's covered by the external fascia. Then you got the cremaster muscle, then the internal fascia, then you got the blood vessels, the lymph vessels and vas deferens inside of that. Okay, guys. So gotta know these guys. Gotta know this. And then spermatogenesis, of course, is produced by helped out by substantial cells. All right, in the seminiferous tubules. And you gotta know the processes of spermatogenesis, right? So we start off with spermatogonia that divide mitotically to produce two cells, A and B, type A, type B daughter cells. The type A becomes the primary spermatocyte, right? Still 46 chromosomes, and then it's has the first meiotic division. It's a haploid. It becomes secondary spermatocyte, all right? Then it then does the second meiotic division. Then it becomes the spermatid, right? And then the fifth step, and then it then differentiates into a sperm cell. Gotta know those steps. Sometimes, can you tell me the steps in spermatogenesis, and you talk about that. And then you say, okay, the testicular cells are the ones that are nourishing these, cells as they develop. Okay, so the testicular cells do that. They are also called Sertoli cells and so forth, and they produce hormones as well. Okay, they nourish the cells. Sometimes I may say, can you give me the functions of the testicular cells? You take to about how they produce hormones, like all the androgens, like even estrogen and inhibin. Inhibin, what does inhibin do? Inhibin can you imagine I can spell this? Inhibin. It's one of the important hormones produced by testicular cells that does what? That it inhibits the formation of FSH. I might ask about that in a sentence completion and so forth. So it inhibits FSH negative. It inhibits FSH. Okay, guys, so gotta know all those things. And okay, so sperm cell structure. Sometimes I may say, you know what? Can you give me the give me the parts of the sperm cell and describe them? Then you'd say what? The head with the genetic material, the mid piece, which has got mitochondria and so forth. All right. The head also has a chromosome on it, which contains enzymes, right? And then the tail, which is a flagella, okay? 3 points. You see what I'm saying? Sperm structure, gotta know this. So all these things I say I'm coming, they're gonna come, okay, guys? So gotta know that, gotta know. All right, there you go. What else we got here? A semen, of course, you gotta know the characteristics of semen. It's white, sticky fluid, all right? And then, the functions of it, of course, is to nourish the sperm cells. Seminal vesicle secretions have fructose in them, okay? And they also got clotting proteins in it, okay? Right? And then the prostate will produce some of the enzymes that will break these clotting proteins so that it becomes sticky. You can imagine it has to stick to the female reproductive tract so it doesn't come out, okay? So all those things, know the secretions of the each of those glands, okay? The accessory organs of the male. And then the bulb urethra, what does it do? It produces an alkaline solution. It also produces a mucus-like solution which lubricates the end of the penis and the vagina too. All right. So regulation of sex hormones. You gotta know about that graph that shows all those hormones from the pituitary, like gonadotropin-releasing hormone from the hypothalamus, causes the anterior pituitary hormone gland to produce LH, which produces sperm cell, which stimulates interstitial cells to produce testosterone. FSH, which stimulates spermatogenesis because it stimulates the follicles. So you gotta know all the functions of these hormones, and then of course testosterone also encourages or stimulates the testicular cells to produce the sperm cells, right? That's why the testicular cells then produce inhibin, which inhibits FSH to stop, because you want to produce enough, you don't want to keep producing, you know what I'm saying? Okay, so that's what that happens. Okay, so gotta know these things, guys, because I will ask about it. All right, and then of course puberty. Of course, that's when you have the release of testosterone. There's enough testosterone that you get gonadotropin releasing hormone, prolactin, FSH forms, and so forth, and then you get, and then of course effects of testosterone. So you gotta know that increased body hair, increase the thickness of skin, musculature, blood vessels as well. They have more red blood cells. Men have more red blood cells because they need more oxygen for the muscles. Okay, secondary sex characteristics, male pattern baldness. Okay, all those things. Okay, so there's many. So usually you ask about that. Okay, so you gotta know that. Male sexual behavior, of course, there's stimulation, which could be psychic or tactile. Tactile is touching, and psychic is just thinking about sex. And then you have, the orgasm, and then you have resolution in male. The resolution period, segment of the sexual behavior in the male is pronounced in that the male it cannot be stimulated after orgasm. It's got to wait a while. No matter how sexy the woman is, nothing is happening. Okay, you know what I'm saying? So neural control, that's where you get
what was this scribble you put on there?
Resolution.
Oh yeah.
Resolution is the final stage where after you have had an orgasm, then you resolve yourself. You kind of come back to earth. You know what I'm saying? During that time.
I know what you're saying.
You want to stay up there though, for a while. But neural control, that's where you have the nerves that control the smooth muscle in the, what do you call this? The arteries leading to the penis, right? What you want to do is relax the smooth muscle so that more blood goes in there, fills up, engorges those erectile columns. So what you do, and every pulse comes, just like at the neuromuscular junction, you release calcium, right? Calcium, what does it do? It's going to attach to those vesicles that release acetylcholine. Acetylcholine attaches to the membrane of the smooth muscle, and it will stimulate a second messenger, all right, through the G proteins, alpha subunit with the GTP on it, and then it will cause smooth muscle relaxation. Or the calcium will also stimulate nitric oxide synthase, okay, where it will convert arginine, the amino acid arginine, into into nitric oxide. Then nitric oxide is a gas, and it crosses the membranes naturally because it's a small gas. Then it will create, stimulate G proteins. Guanine cyclase, it will stimulate that enzyme nitric oxide. Guanine cyclase then converts GTP to cyclic GMP, which also causes smooth muscle relaxation. So those things, I may say, can you talk about neural control of that? And that's like a 5-point question, okay? So we're done with the male now. Okay? Now we go to the female. Again, we gotta know the organs, and I'll go through the female ones, one by one later on. But this is the primary ovaries, and I'll talk about them later when I talk about the ligaments, because I might ask about that in the exam and say, okay, can you tell me the ligaments that hold the or suspend the ovaries in the pelvic cavity, right? Or abdominal pelvic cavity. Then the uterine tube, you gotta know that. That's where fertilization occurs, of course, and I'll talk a little bit more about it after this. And it's got that infundibulum in the fimbriae towards the ovarian end. Is the widest part. It's about 10 centimeters long, and about the ampulla is then the widest part, and it's about 7 or 8 centimeters long. All right. So we talk about that, and of course the uterus, which is what sustains the developing fetus. So we'll talk about that, and then the vagina, of course, the organ of copulation in the female, right? It receives the sperm during sex, and then the external genitalia. External genitalia for the female is elaborate. Okay, you've got the vestibule, which is where those open up. The vagina opens up, the vaginal orifice, and the urethra opens up into the vestibule, and then it's kind of flanked by a thin, very pink
folds. Labia means lips, called labia minora, and the labia minora continue to the top of the clitoris where they form like a hoodie on the clitoris called the prepuce, right? So we'll talk a little bit more about that. And then the clitoris, of course, is the erectile tissue in the female, right? And then, of course, the labia majora covers all of that, and then it covers the. Sometimes I may say, can you describe, if you know, two external genitalia for name and describe, and then name and describe two other for two bonus points. External. So you gotta know which ones are external. The vagina is not an external; it's internal because it's inside. Okay. So if I say external, you gotta describe what's on the outside, right? Just because the vagina opens into the vestibule, it's not external; it's internal. Okay. So don't be fooled over there. Okay. Functions. Over production. So you see what I'm saying? I may say, okay, can you tell me the functions of the female reproductive system? Then you go about that. Overproduction, they have to sustain and receive the sperm cells. Then after that, you gotta carry out fertilization. After that, it's gotta implant and then nourish the developing embryo, fetus, okay, and so forth and so forth, and then produce sex hormones, of course, like estrogen, progesterone, which are responsible for the secondary sex characteristics for the female and production of ovum. So, gotta know all these functions of the reproductive system, generally for both sexes and for specifically for males, specifically for females, because I will ask about some of that. Okay. Then, of course, oogenesis. Okay, I'm actually going to split this oogenesis because we kind of talk about it as one process, but really, we got oogenesis proper, which is just like spermatogenesis, where you have a diploid oogonia, which then go to the haploid secondary oocyte. Okay, and it's got the same steps, meiosis 1 and meiosis 2. It's just that in the female, they are arrested at birth in prophase 1. Okay, of the first meiotic division. Okay, and that means we're still diploid. And then by puberty, that's when you have about 400,000 remaining. And then they do what? Then they're stimulated by LH to then complete the first meiotic division, all right, just before ovulation, and then you get a secondary oocyte that is then arrested in metaphase 2. It doesn't even complete the second meiotic division. You see what I'm saying? Then then it's released. So that you talk about, that's oogenesis per se. And then the part what I was calling follicle development. In the book, we talk about follicle development, and that's what I will use in the exam. But follicle development is also called folliculogenesis. Remember, in the female, you don't only want to produce the secondary oocyte. Right? What else you want to do? You want to produce what else you want to produce in the female?
Polar body.
Well, not really. The polar body is actually just there because of the cell division, and it doesn't really do anything. They just degenerate. But what else do we have to produce?
Something? Well,
Well, before that, what do we need? Starts with the C. It's like a CC.
corpus.
Callosum, yeah. Corpus luteum, Cl. Corpus luteum. The corpus luteum is what produces estrogen and progesterone and sustains the uterine lining while we are making the placenta. Okay, so we need folliculogenesis or follicle development. Sometimes in the exam I'll ask you to specifically talk about follicle development. Okay, it's also called folliculogenesis. Then you talk about what? You get the primordial follicle, which will be the primary oocyte surrounded by flat squamous granulosa cells, right? That's the primordial follicle. Then the primordial follicle becomes the primary follicle when that single layer becomes cuboidal, all right? And it also covered by the zona pellucida, the membrane of the egg cell is covered by the zona pellucida. That's when it's the primary follicle. Okay? Then those granulosa cells, the cuboidal, they start to grow layers and layers and layers, and then they also start to have fluid-filled vesicles occurring scattered throughout those granulosa cells. Okay. Then you also get another layer on the outside called the theca, which has got a theca externa, theca interna that develops and is now secondary also. Secondary follicle. You know what I'm saying? Secondary follicle, because in the exam I might ask about follicle development, not oogenesis. You know what I'm saying? I might ask about spermatogenesis, but then when it comes to female, I'll have you talk about follicle development, because oogenesis is similar to spermatogenesis. So I've asked about that in the male, so you know about that. So we want to know about follicle development because it produces the corpus luteum. So from the secondary oocyte, we, with all those vesicles spread out in the granulosa cells and the theca, or theca externa, theca interna, right? It becomes the mature or Graafian follicle when those fluid vesicles will unite to form one antrum, and then a cumulus mass where the egg cell will be located. Okay, that's a mature follicle and you're done. 5 points, you know what I'm saying? Because I will ask about that. Don't say I didn't say it. Okay. The reason why I say oocyte and fertilization is because the oocyte will be arrested in metaphase 2, okay, and it will only complete the second meiotic division when what happens? The sperm cell fertilizes it. Okay, only if not, it's releasing the menstrual flow. There's a secondary oocyte arrested in metaphase 2. Okay, all right. So gotta know that. And then the other time I showed you the both of them together, follicle development, because this is occurring at the same time as oogenesis. Okay, but in the exam I'm gonna split it for you guys. I want you to tell me just about follicle development, okay, or just about oogenesis. You see? So gotta know that. So I will ask about that. Okay, very good. And of course, gotta know about spermatogenesis. Uterine tubes. What are uterine tubes? Fallopian tubes or oviducts, and I talked about them already. That's where fertilization occurs, and they got this finger-like projection at the ovarian end called fimbriae. All right, and then that last part is the infundibulum. So these are some of the things I might be including in the description, in like the matching section, where I'll say, okay, this is at the ovarian end, and this is the widest part, and what is it called? Then you say infundibulum. Okay.
You say what?
If I say this is part of the uterine tube, that is the ovarian end of the uterine tube, and it's very wide, then you say infundibulum, because the infundibulum is right at the ovary end. But if I say, okay, what is this longest structure, or the longest part and widest part of the fallopian tubes, then what do you say? Ampulla, exactly. That's what I'm saying. So you gotta know these structures well enough that if I describe it, you'll be able to pick it out of a glossary of words, right? Because that will happen, okay? And then, of course, the uterus, okay? By the way, the ligaments that I think I have the ovary later on, right? Do I have the ovaries later on?
Not on this list.
Do I have it later in the lectures? No. Anyway, but I want to talk about the ovary ligaments. You know what I'm saying? Ligaments, before I go into the other ones. Ligaments that suspend the ovary. You know what I'm saying? So this is our little female there, our nice hourglass shape. You know what I'm saying? Okay. Okay, so this is our little uterus. Okay, you know what I'm saying? And this is the cervix. So the ovaries are here. So they got suspensory ligaments that suspend to the lateral side, right? You know what I'm saying? And then what else do they got? They got the ovarian ligaments that attach to the top of the uterus, like that. Do you see that? I'll ask about, can you tell me the ligaments that, secure the ovaries, and describe them? I'll talk about that. I'll ask about that. That's a 2 point with a bonus of 1 point, you know what I'm saying? And then the last one is the broad ligament. You know, the broad ligament is it attaches to the sides of the uterus, and it goes all the way along the tubes, fallopian tubes, okay? And then it also attaches the ovaries.
So what are the upper ones?
The red one is the suspensory ligament.
Suspensory.
Yeah, okay? Because it suspends, you know what I'm saying? It suspends. Sure. And it attaches to the lateral wall of the peritoneum. You see what I'm saying?
Then you have the ovarian ligament.
and then you have the
coming down.
ovarian ligament, and I'm color coding it. You know what I'm saying? Ovarian ligament attaches to the top of the uterus. You see what I'm saying? Because that's where it is, right at the top.
And broad ligament.
And then the broad ligament. You know what I'm saying? What did I do? The broad ligament. That's my color coding. And then the broad ligament. Okay? Because I will ask about this in 3 points. You know what I'm saying? 2 points. 2-point question with a bonus. Anyway, the uterus is got the uterine cavity proper and then the cervical canal. Okay? And it is also suspended by all these ligaments, like the broad ligament, of course, for one, the uterosacral ligament, and the round ligament that attaches to the top. The round ligament kind of goes around it, you know what I'm saying? Around the uterus. So know all those ligaments because it's very important. Why? To anchor that uterus in the abdominal wall, because after a few childbirths, sometimes in women it will prolapse into the vagina because that happens and you have to push it back up like that. Or you can use surgery. Okay? Depending on the severity of that. Okay? And then, of course, the vagina, 10 centimeters long tube, it's muscular, it's got the vestibular, bulbs, which are erectile columns that will squish on the vagina to make it nice and small so that you increase friction between the penis and the vagina. Yeah, you know what I'm saying, during sex. So that's that. And it's one of the internal accessory organs. Okay, so that and that. And then external genitalia, like I was talking about. Remember earlier on, the labia majora, labia minora, the clitoris, the vestibule, and the vestibular glands, the greater vestibular glands that produce mucus-like fluid that lubricates the vagina, right? Those are all external. And then, of course, you've got the mons pubis, which is a fatty mound on top of the labia majora, okay? The pudendal cleft is when the lips, the labia majora are all closed up, okay? And they close up the labia minora on the inside. So, gotta be able to tell me these organs and describe them, okay? And then, of course, mammary glands produce milk. You get the alveoli ducts, glands, okay? And the lactiferous ducts that connects the nipple. And then, of course, you get the areola, which has got all these sort of modified sweat glands that produce oil so that the suckling doesn't cause drying and chafing of the nipples. You know what I'm saying? And then, of course, the bioepithelial cells that contract to squeeze the milk out. And then puberty, of course, you get menarche, the first period, when you have a lot of gonadotropin releasing hormone, which then causes FSH and LH, and you've got estrogen and progesterone increase, and then the secondary sex characteristics start to become more prominent. Then you have the menstrual cycle, okay, which is by definition cyclic events that occur in a mature, non-pregnant female, resulting in changes of the uterus and the ovaries, right? Because you gotta release that secondary oocyte, it's gotta develop from the ovaries, and then of course you gotta prepare the lining of the uterus for childbirth, okay, and for pregnancy, for implantation, okay, not birth yet, because you gotta create it first. Okay, so you gotta know the definition, of course, of the menstrual cycle, what it is, okay, and then of course the phases of the menstrual cycle. You got the menstrual phase, which is like day 1 to day 5, and then the proliferation phase, when you regenerate the endometrium, the lining of the uterus. So sometimes I might say, can you talk to me about, can you name and describe the 3 phases? You do 2 for 2 points and then 1 for the bonus point of the menstrual cycle. So you would say the menstrual phase, where the lining of the uterus, the endometrium, is shared in the menstrual flow, and the second that oocyte is released, day 1 to 5. And then about day 6 to 14 is the proliferation phase, where you regenerate the lining of the uterus, okay, the endometrium, And there's several things that occur in the proliferation phase, where you've got FSH and LH causing all sorts of things. LH is causing ovulation to occur. Remember, LH is what creates, stimulates the secondary oocyte to divide, to finish off from prophase 1 to metaphase 2, so that you have a haploid cell. Okay, it is LH surge that causes that. All right, and it also causes ovulation. So you gotta, sometimes I'll say, can you list the events that occur during the proliferation phase of the menstrual cycle? 5 points, you know what I'm saying? I'll do that. And then, but you also gotta just be able to know the 3 phases generally and be able to describe them for me and tell me what the main thing happening in that stage is, because that would be like a 2-point question with a bonus for 1 point. Okay, so this one is about day 14 to 28. The secretory phase, where you've got the spiral glands that produce that glycogen lipid solution that nourishes our embryo because it hasn't implanted yet. Okay, in the first few of development. Okay, so gotta know that all the events happening in each of the stages. Okay, especially this one, because there's a lot of things happening here. So it's in your book, look at that. Female sexual behavior, of course. Like I was saying, you get the same stages, stimulation, and then you get orgasm. But in female, the resolution stage is not well pronounced because the females can have multiple orgasms, no problem. Okay, and it depends on the female. And then, okay, fertilization. It occurs in the fallopian tubes. Okay, it's what stimulates the division, the first meiotic division to complete, and then, the second meiotic division to complete, and then from, first polar body. Fertilization does that. Okay, and then menopause, of course, this is the most, significant event that happens as females age, and then you get less estrogen and all those sex hormones, and you get problems. I want you to know what happens in menopause, like hot flashes occur because of the, the vascular system is kind of out of whack because of the lack of the hormones. Okay, the female hormones, secondary sex characteristics may shrink, the vagina is drier, things like that, and then, the bones may become a little bit weak, because of the calcium, the PTH is no longer being inhibited by the estrogens. Okay, so that's what happens. And then effect of aging on the reproductive system. Now this is for both sexes, okay? I may just ask about this effect of on both sexes. So for the male, you talk about prostate cancer, benign prostatic hypertrophy that happens, okay? Sometimes you may get low libido, in males, and then for females, you get, ovarian, uterine cancers increase. And of course, menopause happens to females. It's the most significant age-related event in female reproduction. Okay, so talk about that. And this is at the end of the female reproductive system. It's all a bunch of host of stuff listed. So I may ask about that. You know what I'm saying? Okay, so gotta know those effects of aging on the reproductive system. That's for both sexes. You know what I'm saying? And then lecture 8. This is what's happening. What is lecture 8? Pregnancy. Yay! Okay. So after fertilization, what happens? The cell starts to divide. So the early development, you have cell division, and I said you have 2 kinds of cells. Very early on, they are called totipotent cells. And what are the totipotent cells are? They can become any tissue that you need for development. This is any tissue. Okay. Sometimes I'll ask you to describe these. I may give you a description and ask you to pick it up in a glossary of words, a list of words. And then pluripotent, we said it can become some tissues. Okay, because it's beginning to differentiate, so it can't become only tissues, it becomes some tissues, okay? So gotta know those 2. And then the morula is about day 3 to 4. It's a ball of cells, 16 cells, okay? The morula stage. Okay, and then the blastocyst continues. It's about day 4 to 5. It's about day 4 to 5. And the blastocyst is a ball of cells, right? A hollow ball of cells with one layer, or called the trophoblast on the outside, and then the inner cell mass, which is what then becomes the embryo. Okay, the inner cell mass has 2 layers. Okay, one of the layers becomes the embryo, the other layer will start to form the placenta is really formed by the trophoblast on the outside. The other layer of the inner cell mass will form some of the embryonic membranes, like the yolk sac, okay, and so forth. And then the allantois arises from the yolk sac anyway, and then the cells on the top. Okay, so you have that. The blastocyst, it's a hollow ball of cells. So you know these stages of early development, the kind of cells we have, totipotent, pluripotent, and so forth. And then, okay, the structure of the blastocyst and what forms the placenta, which is the trophoblast. Okay, that forms the placenta. Okay, the trophoblast will start to proliferate, and it will produce those 2 cell types, the syncytial trophoblast, okay, the cyto trophoblast, which is the actual cells, and the syncytial trophoblast. Okay, the syncytial trophoblast will be cells with no membrane, plasma membrane. These are the ones that will mesh into the endometrium. Okay, and these cells, together with the cytotrophoblast, the syncytial trophoblast, and the embryonic mesenchyme, which is like a connective tissue membrane, will form the chorion, and then form the placenta. Okay? So that will be, the chorion will be the fetal contribution to the placenta, okay? And the mom will contribute the endometrium, right? So gotta know that. Okay, so the germ layers, this occurs, right about, around 14 days, after about 14 or so days, you're forming the inner cell mass. You've got your trophoblast 1 cell layer, and then you get the inner cell mass here with 2 cells. Okay, these are the 2 cells. It looks like a football. So, and then the epiblast then forms the amnion on the top. Okay, it forms the amnion, which then surrounds the whole embryo, right? And then, and this kind of forms the yolk sac on the bottom. The hypoblast, and in this stage it's kind of called the embryonic disc, right? So gastrulation is on this disc, is the formation, the epiblast cells, which are the cells that will become the embryo, will start to proliferate, and move into the center formation, to kind of form a 3rd layer, and then that is the primitive streak, right? The formation of the primitive streak, that's the gastrulation, is when the epiblast cells proliferate and move to the center, forming a line called the primitive streak. So that's what gastrulation is. Because what is it attempting to do? To form 3 layers, okay? So that this epiblast will keep proliferating, and then it starts to push the hypoblast down, and then you have another layer that occurs, okay, like that. So, and then the mesoderm in the middle is flanked by the endoderm down here by the yolk sac. So the endoderm will be down here by the yolk sac, and then that's what gives rise to the digestive system and so forth. And then these ones in the middle here will form the mesoderm. You see, because the epiblast is proliferating and just creating 3 layers. That's what the germ cell layers are. Okay, so the ectoderm, endoderm, and mesoderm. So the ectoderm is on the outside here, is what forms when the embryonic disc folds up on itself and starts forming the nervous system, right? because I need you to know a few organs or systems that arise from the ectoderm. Skin and them arise from the ectoderm, the nervous system, and then here the digestive system, and some of those other, respiratory and so forth that arise from that. Because the respiratory arises from it's like an outfold of the foregut, which is a tube that becomes the digestive system. So it comes from that mesoderm, muscle, skeletal system, and so forth, right? So that I know some of those things. What is gastrulation? The formation of that primitive streak when those epiblast cells proliferate and go to the center, forming a line called the primitive streak.
So the endoderm is the organs.
The endoderm forms some of the organs, yeah, like the digestive system organs arise from the endoderm.
Respiratory.
The respiratory system arises from the endoderm. There's that table I showed you that is divided into pink, blue, and so forth. It shows a few lists, so you can look at those so that you know at least a few. But I'll keep mentioning some of the important ones when I start to talk about organogenesis. Okay. Okay. All right. Did I talk about the pregnancy, the 3 stages of? Anyway, I think it's coming later. Okay. So know those 3 layers and what they give rise to, and then of course the allantois kind of grows from the yolk sac. Okay, the chorion is already starting to produce as the placenta is forming, right, to those syncytiotrophoblasts, the cytotrophoblast, and the embryonic mesenchyme, right, which is, remember, the connective tissue, embryo, which gives rise to all the connective tissue. Okay, so those are the 2 other membranes, and then the yolk sac. Allantois, chorion, amnion, and yolk sac for fetal membranes. Okay. All right. Very good. There you go. I should have talked about the three stages of. I think I want to talk about them after this of pregnancy, where you have the organ formation, where you have the germ layer formation. Okay. Because I'm going to ask about that in the exam. You know what I'm saying? Germ layer formation. Okay. And then 2 is organ formation, organogenesis. That's the stages of pregnancy as a whole. You know what I'm saying? Of the whole gestation period, these are the 3 things going on. Okay, that's what I should have talked about right at the beginning. Okay, I forgot. But now I'm talking about it because I will ask about that. Don't say I didn't tell you. Then after, about a month or so, you've got all the organs there. And then the last is just hypertrophy, growing and maturation. So the 3rd steps of the pregnancy is growth and maturation. Okay, guys? Which kind of happens in the last trimester. So those are the 3 stages of pregnancy. Sometimes I'll ask about that. 2-point question with a bonus point. Okay, so yeah, germ layer formation, organogenesis or organ formation of the organ systems, and so that's a 3 points right there. 2 points with 1 bonus. Okay, so like I was saying, that embryonic disc is straight and the ectoderm is on the outside, right? And then it starts to fold up on itself, forming the neural groove and the neural crest cells. So those, once it's folded up, about day 21, 26, it starts to fold up, and then by day 26, that form a neural tube. So sometimes you may get congenital malformations if this tube doesn't completely form a tube, and then you get problems with your nervous system. It's going to be malformed. So those cells, after you form the neural tube, after the embryonic disc has folded up on itself and forms a tube, they are called neuroectoderm cells, right? Neuroectoderm. And you know what? We talked about it. We said the nervous system arises from the ectoderm. Okay, remember it's one of those things that we talked about when we were talking about the germ layers. The nervous system, although it's internal, it really arises from the ectoderm. Okay, so that's what they call neuroectoderm cells. Okay, and then it kind of folds up on itself like this, Okay, and then it will fold up like that, and then it forms neural crest cells on the top here. where it folds up. Those neural crest cells will then form most of the peripheral nervous system, okay, and some of these other structures, okay. Then somites, remember somatic nervous system, so you get the somite formation. After you form the neural tube, which will be like this, okay, with a notochord at the bottom, then you have the somites that arise. So at this stage, it's kind of looking like a fish. The embryonic disc is kind of oval shape, like that. And then the somites gives rise to the skeletal system, ribs. What's that? What's that, Steph? Did you ever... Yeah, growth and maturation. Yeah. Very good. Okay, did you see that now? Those are the 3 stages of pregnancy, by the way. I should have talked about it at the beginning. I'm going to ask about it. So I hooked you up, guys. I told you. Anyway, the brain develops, just brain development. I just want you to know basically, the telencephalon becomes the cerebrum. Okay, the diencephalon becomes the diencephalon, which is the thalamus and the hypothalamus. Okay, and a few other structures. The mesencephalon becomes the midbrain. Okay, part of the brainstem. The metencephalon becomes the pons. Okay, and then the myencephalon becomes the medulla oblongata. Okay, so in the exam, I may just expect you to know just this, what these major parts of the brain arise from. Remember when we talked about brain structure in ANP1, we talked about the cerebrum, the diencephalon, and the brainstem. Okay, and the cerebellum is part of the major parts of the brain. Okay, so medulla oblongata, right? Okay, so gotta know that. Yeah, that's about the brain. And then of course limb development around day 28, 35 or so, around month old. Then the limb buds form, and we talked about how they form from the proximal part to the distal part. So it will start forming the upper arm, then it will form the forearm, then it will form the hands, then the fingers. The hand includes the fingers. But that's how it goes, okay? It doesn't start growing fingers right here, then, they'll get attached to the shoulder or something. Okay?
What is that word on top of the limbs?
Oh yeah, cerebrum, yes, cerebrum. You see my neat handwriting, you know what I'm saying? Cerebrum. Okay, guys? And there's a picture that shows this in the books. So organ system development, remember those are the stages that I'm talking about for pregnancy, organogenesis, and so forth. Organ system development, where you have the respiratory coming out of the foregut. So you have an outfold from the neural tube. It forms the foregut, and then it folds out, and then it starts to form the respiratory system where the trachea forms, and then it splits into 2, and then you grow the lungs and so forth. Okay, and that's that. So those are the few systems. I need you to know about how the urinary system grows. Okay, it starts off with the pronephros, which we said is really non-functional in either the embryo or the fetus or the human itself. And we talked about how this may trace its ancestral forms during the development. That thing that I was saying, ontogeny recapitulates phylogeny. Okay, but anyway, this is non-functional, but it's functional in lower chordates, lower animals that have a backbone like us. Okay, so that's why we kind of sort of follow the ancestral forms. And then the mesonephros forms the urine. So it's a functional kidney in the fetus, and it produces urine, which is what produces the amniotic fluid, right? We start off by producing it from the mom, but then after that, the baby takes over by producing its own amniotic fluid through that mesonephros. And then the mesonephros is where the reproductive system also grows. Okay, and we'll talk about that. So the metanephros will be the mature kidney, the actual human adult, grown up human, or the fetus, in the neonate, newborn, and to adulthood. So the paramesonephric ducts will be growing close to the metanephros, okay, close to the mesonephros, I'm sorry. And then the mesonephric ducts will grow in there at the same time, simultaneously. So you could be boy or girl at that stage. Okay? So now testosterone happens, and then it will switch on this guy. So the mesonephric becomes the male ducts and so forth, and the male reproductive system forming the vas deferens, whatnot. Okay, and then the Mullerian inhibiting hormone, because I may ask about how the sex, what happens with that sex formation in the fetus. Then Mullerian inhibiting hormone will inhibit this, the paramesonephric ducts, which gonna become a female. So this will inhibit that, okay, and this will plus that, okay. See what I'm saying? And then in the absence of both of these, the opposite happens. These need testosterone to develop, they degenerate, and these are no longer being inhibited by Mullerian inhibiting, and they grow and you get a girl. So the mesonephric male and the paramesonephric the female parts, and they grow at the same time. But then when these hormones happen, they switch the paramesonephric off and switch on the mesonephric ones. Okay, so that's that, and then growth of the fetus. Those are the stages I talked about at the beginning.
So the testosterone supports the mesonephric
ducts to grow.
And the
Mullerian inhibiting hormone will inhibit the paramesonephric ducts. Because if Mullerian inhibiting hormone is not present, that's when you can get a child born with two sexes. Because then it will grow the female parts too, as well as the male parts. Because sometimes you get a release of testosterone, and then you start developing your penis and your scrotum and everything, and then you with it, if this is lacking, then this is not going to be inhibited. Maybe there's a little bit of Mullerian inhibiting hormone, so you get the rudimentary female reproductive parts with it. So you get both. And they're usually infertile. Okay, so you need both of these to form a boy. So that means every embryo is destined to be female unless the testosterone and Mullerian inhibiting hormone happen. If they don't happen, it just grows naturally to be female. Okay. Gestation period, including the 14 days, it's called the clinical age, is 280 days. All right. And then I want you to know about how the fetal glucocorticoids, cause what you call it, cause labor to happen, parturition. Okay, so when the fetus is stressed, what happens? It's going to release corticotropin-releasing hormone from the hypothalamus, which causes adenocorticotropic hormone, ACTH, to be released from the anterior pituitary. Okay, and because I may ask about that, how the fetal stress, starting with hormone secretion from the hypothalamus of the fetus, will cause the labor to occur. So what happens? ACTH goes to the adrenal glands, and it causes that layer, the zona fasciculata, to form glucocorticoids, like cortisol. Then cortisol goes to the placenta, and then it switches on estrogen and switches off progesterone. And that imbalance will start to cause oxytocin secretion, okay? And then oxytocin secretion will cause the uterine lining to contract the muscles, the myometrium to contract, all right? And then, of course, oxytocin is going to be secreted in a positive feedback fashion, so that more oxytocin is released, more and more and more and more. Okay? But I want you to know the events that start off, and there's a diagram in your books and in the notes as well, in the notes I gave you, where the fetal hypothalamus, when it is really stressed because it's now being cooped up in that uterus, it will start to release corticotropin-releasing hormone, then ACTH from the anterior pituitary, that goes to the adrenal glands, causes the formation of glucocorticoids, which go to the placenta and then switch on progesterone, switch off progesterone and switch on estrogen. And that will activate the uterine contractions. Okay? So, gotta do that, gotta know. And then, of course, you gotta know the stages of labor, because I might ask that 3 points or as a part of a bonus for a 5-point question. I'll say, can you name and describe the stages of labor? So the first stage is when the cervix is dilating, okay, and it takes about, 8 to 24 hours or so. And then the second stage, that's when the cervix is fully dilated, and then the baby's coming out. When it comes out, that's the completion of it. So you describe that, okay? It could take a few minutes to an hour, depending on the female, okay? So I want you to talk about that. And then the third stage is what happens? The afterbirth. The delivery of the placenta, okay, and then you talk about that.
So second stage is expulsion?
Yeah, second stage is expulsion from the maximum, what you call it? Cervical dilation. They'll never ask you to push until the cervix is fully dilated. Okay, so gotta know 3 points or some kind of bonus points or something. Newborn, I want you to just know the first, what happens when the digestive system, kind of changes. The first meconium is it's got the bile in it, it's got the amniotic fluid in it, and then it's got structure of cells from the digestive tract of the, the fetus and so forth. So at first, and it's black in appearance because it will have, bile in it. Okay, that's what's called meconium. Then the stomach will start to produce acid much later, and then of course for the first 2 weeks or something, there's no bilirubin, which is a liver pigment. So the liver is not functional, and then so you can't feed solids. You only can feed milk because lactose can be digested right from the get-go. And then you know what congenital disorders are? These are malformations that occur at birth. Okay, if the doctor drops you sloppy because the baby is slimy and then you break a shoulder, that's not a congenital malformation because it occurred after. See what I'm saying? But if it happens when you're born like that, that's a congenital malformation. And there are certain environmental agents called teratogens which cause congenital malformations. Okay, so you'll be able to know what teratogens are. You'll be able to describe
alcohol, them. Cigarette smoke, stuff like that.
Yeah, things like that. Alcohol, you get fetal alcohol syndrome and so forth. And I talked about Accutane, which is vitamin A derivative. Okay, lactation, estrogen, progesterone. Estrogen production of increase in growth of the mammary gland, and progesterone will cause the glands to grow that actually produce milk. Okay, I want you to know what the function of these are. Prolactin causes milk production, milk synthesis, and this oxytocin causes milk letdown, because oxytocin causes the contraction of the myoepithelial cells lining the glands. Okay, so gotta know the two differences. And this is anterior pituitary. Prolactin is released by the anterior pituitary. Oxytocin is released by the posterior pituitary. Okay. There you go. So that's it. So now I got a few minutes, 5 minutes. The birth control is the easy one, you know what I'm saying? And it's short and sweet. So be able to define birth control, right? Remember what I talked about? It's, your regulation of how many kids you have and when you have them. So if I ask you to define, which I will, okay, you gotta tell me about, your regulation of how many kids you have and when you have them. You gotta include those two. If you only have one of those things, I'll give you half a point. Okay, contraception is not birth control. Contraception is a mechanism that actually stops, the development of the embryo, the release of the, you know what I'm saying, or the implantation of the blastocyst, or the release of the egg or whatever, or to actually prevent fertilization from occurring altogether. Okay? Or if fertilization has occurred, contraception can also occur by preventing the implantation of the blastocyst. Okay? Alright, so, and then we get all these methods, okay, and which I'll talk to you about them in the future slides. Birth control methods are not to be confused with birth control, are not to be confused with contraception. Do you see the differences? If I ask about birth control and you give me an example and you say coitus interruptus, that's just an example, it's a method, okay, it's not birth control, okay, it's what you use to practice birth control. So you have to define birth control, and if I say give me an example or describe a birth control method, then you can go there, okay, because too often students do that in my exams. They will start to give me methods of birth control. I'm talking about contraception, I'm talking about birth control, I'm not talking about those methods. Okay, so beware of that. Okay, now we're talking about birth control methods, and if I want you to talk about these guys, I will ask it. I'll say, give me a birth control method. Okay, okay, so then you gotta be able to define it. Like for instance, coitus interruptus is when you interrupt sex. Okay, so it's pulling out, it's a withdrawal before ejaculation. But then there are disadvantages of that because, by the way, sperm might have already entered by the time you withdraw. So you decide, no point, okay? And then, you know, mechanism is that, you know, it prevents the sperm from getting to the egg, right? And then timed coitus or natural family planning is when you abstain from sex, you know, 2 days before and 1 day after, okay? But you need a little bit more than that. We talked about it, right? Because sperm can survive up to 5 days. So you define it, and then you talk about the mechanisms, okay, which is, you know, abstaining from sex 2 days prior, you know.
That would be the rhythm
1 day. Oh, yeah, that would be the rhythm method, which is timed coitus, which is also called natural family planning, okay? Because sometimes I may say, okay, this method, what is called also called timed coitus, then you say, oh, rhythm method or whatever, okay? Could be multiple choice question that does that actually. Okay, but this is same as timed coitus, rhythm method, natural family planning.
My parents were not very good at it.
Yeah, because those guys, they just had sex all the time, and you know they get pregnant all the time. Because the rhythm method doesn't work. That's one of the disadvantages because it's hard to identify the fertile time. So you go look at that birth control, and for each of those, know those three. You know what I'm saying? Mechanical barriers, they really don't have advantages except, you know, when you're young and you apply it improperly and then it breaks. Boom. Then you have a problem. But they work better with chemical barriers. Okay, they increase the proficiency because if it breaks, then the chemical barrier might get it. Okay, so gotta know that, and you know what the chemical barriers are. In lactation, we talked about it. It can cause the inhibition of GnRH, gonadotropin-releasing hormone. Okay, so that you don't get FSH and LH, but only for the first few. Okay, after that, the menstrual cycle resumes and you can get pregnant. Okay, so it's not a reliable method to use. That's what it's kind of tied up with natural family planning. Okay. But lactation itself can cause, you know, birth control, but it's not consistent, of course. And the combined hormone contraceptives. This one you talk about the definition, which is application of estrogen and progestin in combination. Okay, and how does it work? Because I will ask about you to define the method, how it works. So this one works by disrupting FSH and LH, the combined hormone contraceptive. That's the mechanism. Okay, and then this one I talked, he said about the disadvantages because it's really none. You know what I'm saying? But there's 4 ways it can be delivered: by a vaginal ring, by a plastic patch, by an injection every month, and by the orally, the pill, which is the most common. So if I ask about that, I want you to know about that. And then injectable contraceptives, not to be confused by injections of combined hormone contraceptives. Injectable contraceptives, by definition, it's intramuscular injection of depo-provera. How it works? It's effective for 3 months. It lasts 3 months. Okay, and then it prevents the release of the secondary oocyte, right? And then it makes the uterus hostile to the embryo. You know, God forbid, but it does that. And then disadvantages, of course, weight gain and, because I will ask about this. You know what I'm saying? So, and then it will say take 10 to 18 months, you know, to reflect the effects. Would want to wait 2 years just to get pregnant again. You know what I'm saying? So this one is the big disadvantages. Plus weight gain, the females on one. Okay, intrauterine device. We know that it's a device that's placed into the uterus. And then what does it work? How does it work? It prevents the blastocyst from implanting. So it doesn't prevent fertilization. Okay, and therefore, but we know about the disadvantages, right? Spontaneous it can be spontaneously expelled, you know, causes heavy bleeding during the menstrual flow, okay, things like that, okay, and it can damage the uterus, okay. Surgical method, we don't know about that. Tubal ligation for the female. So I want you to know which one is for which, okay, and then of course vasectomy for the male, and then of course there's really, these are, you know, very effective. I have 100% sterilization. Okay, as long as you wait a couple of months or so after vasectomy, because you still have sperm in there, or you don't have to wait to use a condom until you're done releasing all the sperm cells, normal sex drive, and everything. Okay, guys? So that's about it, guys. Thank you so much. I appreciate it. We shall see you in the lab in a few, okay? Thank you. I appreciate it, guys. So this exam is actually going to be fun for you, I promise. You'll like it, especially the middle section. I was really thinking about that.